for signs of infection in an abdominal or caesarean section wound postnatally is really important. We want to pick up any infections early, start treatment, so that this helps to reduce any longer term complications. So keeping an eye on your wound is really important. We want to look out for any signs of increasing redness, swelling or pain to the area. Generally, your caesarean section wound should get less painful and less inflamed in time. So if you suddenly notice you seem to have reverted backwards, that would be a red flag to speak to your midwife and or GP about. An increase in your bleeding vaginally or any offensive smelling discharge vaginally. Any discharge or oozing from your wound, especially that smells offensive. And a general feeling of feverish. So if you've noticed that suddenly you've got a temperature and perhaps you're feeling hot and cold and shivery, that may also be a sign that there is an infection. Sometimes after a caesarean section, women develop an infection somewhere else in their body. So for example, a urine infection from having a catheter in situ. So that might be stinging or burning when you pass urine, perhaps going to the toilet very frequently for very small amounts, or blood in your urine. So it's important that we recognise with a caesarean section, there are potentially multiple wounds in our body, there has been different degrees of tissue trauma, and therefore there is an increased risk of infection to some different areas of our body. So if you notice that you are starting to feel unwell, it is really important that you flag that to your healthcare professional so that they can support you to get better sooner.